Well, good afternoon, everybody. It's 12:30 here in the Washington area, and we appreciate you all being with us. We want to go ahead and get started. This is Mike Fraser. I'm the Chief Executive Officer with the Association of State and Territorial Health Officials, and our members are the Secretaries and Commissioners of Public Health in all the 59 states and territories across our country. We wanted to convene a call today to share some messaging around getting ready for the July 4th holiday and urging all Americans to practice social physical distancing as well as mask wearing when outside, and certainly wanted to urge everybody to follow the recommendations and instructions of their state and local health departments as we go into a holiday weekend where we know many families and friends will be gathering. As you all well know, the COVID pandemic is not over, and we need to redouble our efforts to prevent the transmission of the virus. And on our call today, we have three experts, secretaries and commissioners of public health from across the country, to join us and share some of what's going on in their state and ways that we can work together nationally, again, to address preventing COVID. I will briefly introduce our three panelists, and again, just folks, this is an open line. We wanted to have a simple line, not an operator-assisted line, but even if you think you're on mute, please verify because there is some background noise. I'm really pleased to introduce the president of ASTHO, Dr. Nate Smith. Nate is the Secretary of Health at the Arkansas Department of Health. He's an infectious disease physician with a great deal of experience, and will be sharing the Arkansas case as well as his thoughts nationally about COVID. Dr. Rachel Levine is the Secretary of Health at the Pennsylvania Department of Health, and she is the President-elect of ASTHO. She's a pediatrician with a specialty in adolescent medicine, and we're excited to have Rachel on the call as well. And finally, it's really a pleasure to have Dr. Monica Burrell with us, who's Commissioner of the Massachusetts Department of Public Health. She's an internal medicine physician and has both a professional and personal story about COVID, and it's important for us to have all three of them on the line to tell us what's going on in their state and hear their recommendations for the nation. So I'm going to turn it over first to Dr. Smith, then I'll turn it over to Dr. Levine and Dr. Burrell for brief comments, and then we'll open the conversation to questions from the media. So let me turn it over to you, Dr. Smith. Thanks for being with us. Tell us what's happening in Arkansas and any highlights or issues you want to be sure to share.
Well, thank you, Mike. We have been through a lot in Arkansas, just like all of our other states and territories. In overview, back in mid-May, we thought we had been over our crest, and we were down to, at one point, fewer than 20 cases a day. Well, that's not how things worked out. Shortly before Memorial Day, we started seeing an increase in the number of cases, and we peaked out at over 700 cases a day. And then we've been seeing over the last week a generally downward trend, but our big surge and increase in cases was driven primarily by an increase in cases in the northwest part of our state. Our Latino community was disproportionately impacted, and at least some of these clusters outbreaks were related to our poultry industry. So we are now seeing some improvement over the past week, but still at much higher levels of cases than we were certainly in mid-May, and we're looking at the states around us where some of them are reporting record numbers each day, and obviously very concerned. Briefly, three things that I'm going to share as an impression. One is that looking at the numbers or the curves is not enough. You really have to get down into the local outbreaks and see what's driving it. In our cases, it wasn't it wasn't restaurants, it wasn't barber shops. It was it had to do with communities that we needed to engage better, with industries that we needed to work with more closely, And so, local outbreaks have local drivers, and it's very important not to sit back and just look at graphs and numbers without an awareness of the situation. The second is that there are some common themes across our states, and one of them is the challenge of getting consistent behavior around wearing masks or face coverings. That's more of a challenge in some areas than others, but I think all of us are facing that challenge. This is essentially going to end up being a life-saving survival skill, and we're going to need to teach it to ourselves, but also to our to young people, especially moving forward. And then the third take-home message is that although much of our focus, both in Arkansas and elsewhere, is on urban areas of concentrated population where we see the ability of COVID-19 to spread very, very quickly and cause a large number of hospitalizations and even deaths, there's also a significant impact in the rural areas, even where you see very few cases, because there's an impact on the local economy, the impact on the local culture and society, including mental health challenges having to do with isolation, and particularly challenges with sometimes very fragile healthcare systems in those rural areas that were struggling before, but now can be pushed over the edge, even if there are not very many cases. And so with that, I'm going to go ahead and turn it back to Mike and be available for comments after the other speakers have had a chance to share.
Great. Thank you, Dr. Smith. I'd now like to turn to Dr. Rachel Levine, who's the Secretary of Health in the Commonwealth of Pennsylvania.
Well, good afternoon. Thank you very much, Mike, and I'm very pleased to be here today. So after more than 6 weeks of steady declines in the number of new cases in Pennsylvania, over the last week we have now seen an increase in terms of the number of new cases that we are seeing per day. These increases are primarily located in southwestern Pennsylvania, particularly in Allegheny County, which is where the city of Pittsburgh is located. So we are working in very close collaboration with the Allegheny County Health Commissioner, Dr. Deborah Bogan, and working with her, we have determined that these increases are actually driven primarily by younger individuals in their 20s and 30s, maybe 40s, that some of whom have had traveled to areas in the South, such as Florida, and then come back and have been congregating in bars and in restaurants without masks and without social distancing. And that seems to be driving the increases in Allegheny County and the Southwest. So we are responding with our containment measures. So that includes expanded testing, and we're working with her to expand testing even further in Allegheny County. In addition, then we would be doing with her case investigations of positive cases and then contact tracing to determine those close contacts with appropriate isolation and quarantine. And of course, in Allegheny County, she would have lead that with her health department. In addition, she has done targeted mitigation where she has actually, because of the issues with bars and restaurants, prohibited the sale of alcohol starting yesterday in bars and restaurants. There's only pickup service only for alcohol, and we support her targeted mitigation efforts as we do all of her efforts. So we're going to be looking at increases in other counties and working on containment in the Southwest or anywhere in Pennsylvania that we might be seeing increases. And I'd like to highlight something that Dr. Smith talked about, which is really the importance of mask wearing. I mean, that has been shown over and over again now and demonstrated scientifically to be extremely important in terms of preventing the community spread of COVID-19. We also want to emphasize the importance of social distancing and hand washing, et cetera. And this is particularly important as we enter this July 4th holiday weekend. So that would complete my remarks. I'm pleased to hand it back to Mike and also pleased to answer questions.
Great. Thanks, Dr. Levine. We'll take questions in just a minute. And I think even in our two speakers already, we hear some of the local variation that Dr. Smith was talking about in terms of really getting to know the data. But now let me turn it over to Dr. Monica Burrell, who's the Commissioner for Health in Massachusetts. Dr. Burrell, thanks for joining us.
Thank you, Mike. Can you hear me?
Yes, loud and clear. Thank you.
Thank you for this opportunity to join you today. As we're all aware, this virus has had a devastating impact on our society, the education of our children, on employment, on our economy, and most importantly, the health of our residents. I can't talk about this pandemic without acknowledging the tremendous suffering and loss of life it's caused. We were hit hard by COVID-19 here in Massachusetts. As of today, we have had more than 107,000 confirmed cases, and more than 7,800 individuals have died from this pandemic in our state. Our peak in cases was in April, and since then we have had a steady decline. Based on public health metrics, we have begun to cautiously do a phased reopening as of May 18th. Yesterday, we reported 114 new cases. So the steady decline continues. Our COVID response and our reopening has been guided by a focus on public health data. As part of our response to COVID-19, we've collected and reported out daily metrics on cases, testing, hospitalizations, recoveries, and much more. And our dashboard is considered one of the most robust in the country, and we update it every day after 4 p.m. Under the leadership of Governor Baker, we have been able to slow the spread of the virus by doing a few things, by using extensive data metrics and implementing social distancing and implementing face mask measures. The data has been a key to driving our decisions. Every day we ask ourselves, what does the data tell us, and what is the latest scientific evidence on how to slow the virus? With this approach, we are seeing positive results. The positive test rates are now around 2% here in Massachusetts. The number of patients hospitalized is down 75% from our peak in April, and the transmission rate, or the R0 in our state, is one of the lowest in the country. These metrics are a result of many different aspects, but importantly, these metrics are a result of policies we've put in place and our residents' cooperation with our directives. Again, as Dr. Smith and Dr. Levine emphasized, our residents are following our directives to wear face coverings, remain 6 feet apart, not attend large gatherings, and practice hand hygiene. These metrics have allowed us to begin our cautious phased reopening. Also key to our reopening is testing. About 10,000 tests are conducted here in Massachusetts each day, with more than 1 million tests done to date. Testing in our state focuses on individuals not only with symptoms, but those who have had contact with a confirmed case and individuals in high-risk settings, including congregate care and nursing homes. Another key component of our response has been contact tracing. Contact tracing is, as you know, a well-established public health strategy for controlling infectious diseases. As our numbers of COVID cases began to rise in Massachusetts, we were among the first states to create a statewide contact tracing program to augment the work of our local boards of health. After Governor Baker's stay-at-home advisory went into effect in March, we saw the numbers of contacts that each COVID case have dropped from an average of 10 contacts to around 2 contacts, and this was further evidence that social distancing was being practiced. As we gradually reopen, we expect that our case numbers may grow, and we have our contact tracing program structure in place because it will be a key part to us being able to trace those cases and contacts. We're closely watching the public health metrics as we reopen, ensuring that our cases and deaths are not rising, and the healthcare system has adequate capacity to care for both COVID and non-COVID patients. The phases of reopening depend on these metrics. Our metrics and data have also uncovered a disturbing but not surprising finding that COVID-19 has had a disproportionate impact on our communities of color. And this is just the latest indicator of the health disparities that have long existed and that demand our action and are an important part of our current COVID-19 work in Massachusetts. We continue with our slow and steady approach to reopening. As new information about the pandemic becomes available, we will need to adjust our course. I'm proud of Massachusetts having a strong public health and healthcare system and near universal health care. We've put strong measures in place and have seen good results. But most important to me is that this pandemic is far from over. We must continue to stay vigilant. And I would like to share in Dr. Smith and Dr. Levine's important and critical points of the behavioral measures that we can put in place that will stem the spread of this virus. Thank you. I'll hand it back to Mike.
Thanks, Dr. Burrell. Now is our time for questions. I want to start first, though, and just say, what recommendations do you have for the July 4th weekend with folks that may be contemplating a drive, maybe an out-of-state drive, or a barbecue or a gathering of friends for July 4th?
This is Rachel. I guess I would recommend that people strongly consider staying local. And staying home or staying local, that if they're going to have gatherings, that they keep them small, that they continue to wear masks, that they social distance as much as possible, and that they stay alert and vigilant against the spread of this virus.
This is Nate. I would add to that. Agree with everything that Dr. Levine has said. Outside activities are safer than inside activities for the most part, and most of the things that you'd want to do, you can do in a way that's safe, just maintaining at least 6-foot distance between, wear those masks when you can't consistently maintain that physical distancing, and there's a lot of things that can be done outdoors with space that can be done safely. So people shouldn't have to think that they either celebrate or they don't celebrate. Just do it in a way that is safe and protects yourself and others.
And, this is Monica Burrell. I'd like to add to that I do appreciate the fact that people are tired of being locked inside their homes, and they want to see their friends and their relatives, and I do too. And it's really about weighing the risk versus the reward. We know that we can't let down our guard, and we know that the virus won't, unfortunately, suddenly disappear, even though we want it to, but we're learning more about this virus every day, and things are evolving. And we do know, to Dr. Smith's point, that outdoors is much safer than indoors. So taking advantage of good weather, coming together outdoors with 6 feet distance, wearing masks when you can't keep that distance, and remaining vigilant about hand hygiene are all great points.
Great. Thank you all for that, those answers. Why don't we open it now? If folks have questions, please just introduce yourselves and your outlet, and we'll get going with questions and answers.
Hi, it's Mike Stobie from the Associated Press. Could I start with 2 quick questions? Michael Fraser said, what recommendations do you have for the July 4th weekend? Let me ask each of you in your state, what are you recommending to school officials about how to handle the opening of schools and spacing or whatever else? And the second question had to do with overall infection fatality rates or case fatality rates, if that's all you have. I was wondering what you were seeing in each of your states, and even if it's stating the obvious, why would those death rates vary from place to place? Thank you.
Great. Thanks, Mike. First question, school guidance. Anyone want to take a stab at that?
Sure. This is Rachel. So we're working really, really closely right now with the Pennsylvania Department of Education on school guidance, with, of course, separate guidance for K-12 schools and then for colleges and universities. I would like to point out the CDC just released their guidance yesterday for K-12 schools and for universities, so our teams are poring over that to glean important information, and then those guidances will be released in Pennsylvania presently.
Okay, and Arkansas and Massachusetts.
This is Nate. I would agree on the school. It's not a simple issue, but I think departments of education, school systems, they can work closely with their state and local health officials to find solutions and approaches that are tailored to the specific situation, but using principles that we've learned since the beginning of this epidemic.
This is Monica Burrell in Massachusetts. I would add that, again, the role of children in this pandemic is evolving, and is a lot of research is happening in that realm. Today's July 1st, and school opening in terms of planning is very close by, but in terms of virus activity is still far away. So we are working very closely to look at what the data and metrics show, and our school systems are looking at guidance based on having multiple different scenarios set up based on what the metrics show are happening at the time.
So a little bit of wait and see, looking over the CDC guidance, and a little bit of time to figure that out. What about case fatality rate differences?
This is Nate. Case fatality really does vary a lot depending on the population that's been infected. And I think that's part of why you see regional differences, but even within states. For example, in Arkansas, nursing home residents only make up 2.7% of all cases, but they make up 36.7% of deaths. So, our overall case fatality rate is just a little over 1%. But amongst nursing home residents, it's considerably higher than that. And so, if you have outbreaks amongst high-risk individuals, particularly nursing home residents, you'll get a much higher case fatality rate.
Okay. What's it in the other two states?
This is Rachel. So I would agree with that. So the majority of the tragic deaths that we have had in Pennsylvania have been in nursing homes and other long-term care living facilities, and I think that highlights the challenges of taking care of seniors, especially those with chronic medical conditions in congregate settings in the face of a global pandemic. There is recent evidence from academics at Brown and Penn is that really the prevalence of cases in nursing homes is directly proportional to the prevalence of cases in the county where they're located. And so it's just that they're particularly vulnerable individuals, and we have seen that pattern that they have seen in Arkansas as well.
The only thing I would add to that, this Monica in Massachusetts, is if you go to our daily dashboard, you can see the total number of deaths we're reporting. Yesterday was at 8,054, and you can see how many cases we've had there. We are really tracking, just like was mentioned, where the deaths are occurring, and we have seen about 60% of our deaths have been in long-term care facilities, and we've been working very closely with them on many aspects of doing regular testing, infection control, and staff and resident education.
Great, thanks. Why don't we, other questions?
I have Brianna Ely from Politico.
Oh,
sorry. Okay. This is Brianna Ely from Politico. I just had a quick question. Would officials on the call like to see the Trump administration announce a national mask or face covering mandate?
This is Rachel Levine, and the answer would be yes.
This is Nate Smith. I think in my state and probably similar states, we would like to have some, we'd like to have the states, that's normally the kind of thing that a state would determine, and even you get input from localities within the state. Because, we visited a county, last week where there was one active case in the entire county. So, trying to do that at a national level, could get complicated.
This is Monica Burrell, and I would appreciate and emphasize that for us in our state, following data and following the most recent scientific evidence has been key, including reports of mask use decreasing death up to 50%. We know that we can drive down the reproductive numbers of this virus by behavioral change, so we have made that a key part of our efforts of communicating with our residents in Massachusetts that following these behavioral changes, face masking for all, social distancing, and hand hygiene is the way to decrease the transmission of this virus.
This is Nate. I would just like to add to that briefly. All three of us are absolutely in agreement that face masks save lives. They should be practiced. I guess the open question is whether a mandate at the state or federal level, how that's going to, how effective that will be at promoting wearing face masks. And I think there are some local and regional differences there.
Great. Why don't we go to the next question?
I have a question for Dr. Smith. This is Marissa Courier with CNN. You said that Arkansas's increase of cases wasn't restaurants or barbershops, but the state needs to engage communities and industries better. I was wondering if you could clarify what you meant by that.
Yes, I'm sorry. In our case investigations, we've asked about exposures to all these places, particularly as we never closed down completely, but as a state, but as we open some of these up. But we have noted a number of cases associated with poultry-related businesses, and as an example. And of course, we've seen a lot of cases in nursing homes. We've seen a lot of cases in correctional facilities. But what I'm saying is these industries and businesses where we have had clusters, that's where we need the engagement.
Great. Next question.
Hi, this is Stephanie.
This is.
I wanted to ask. I know that you sort of said that it seems like you're concerned about a spike in cases for the July 4th weekend, but do you have any evidence based on what we've seen from Memorial Day or other holidays? I mean, are you expecting a pretty big spike in cases after the 4th of July holiday? And if so, I mean, do you have a sense of what you might expect and where you might be seeing those?
This is Rachel Levine. So I think it depends upon whether people comply with the instructions that we're talking about today. Meaning, I think that if the vast majority of people enjoy their holiday weekend safely, spend more time outside, wear masks, socially distance, wash their hands, use hand sanitizer, then I think that there'll be a much safer weekend and we wouldn't see those increases. If people are in restaurants, bars, or other locations, if they're in large crowds, they're crowded together, they're not wearing masks, and they're not social distancing, that's what would pose a threat. It's hard to predict what the outcome will be, but of course we'll all be very vigilant to work to contain any spread.
So do you think like cities and states should be canceling fireworks displays or closing down beaches or doing things like that to kind of keep people from getting sick?
Well, we haven't. We don't have any beaches. Well, we have beaches, I guess, for lakes. But we have not closed those down. We're, of course, not on the ocean. In terms of fireworks, I mean, we have limitations in terms of gatherings of 250 people. So we haven't closed those down, but we're hoping that the gatherings are smaller and that people social distance.
Yeah. This is Nate. My biggest concern with 4th of July is that in Arkansas, we have more than 3 times as many active cases now as we did Memorial Day weekend, and so the same activities are going to be associated with a higher risk of acquiring COVID-19. So we need to be more vigilant this time than we were Memorial Day.
You know, and I think it's Monica Burrell, just to add that it really cannot be emphasized that we should wear our masks or face coverings, practice social distancing, and proper hygiene. And if you look at this week's from 620 MMWR through the CDC, one of the risk factors for the spread of this coronavirus virus is gatherings greater than 10. So we still have a limitation here in Massachusetts as well on gatherings. And we ask that people think about these behavioral changes that we can all do because it's really going to take all of us putting these efforts in together to stem the tide of this virus.
Great. Thank you. Thank you, Monica. We're at the top of the hour, and I know there may be more questions. I'd like to refer everybody to Jane Esworthy, who's our Senior Director for Public Relations, J. Esworthy, ESWORTHY, at ASTHO.org. And Jane will be happy to manage any follow-up or continue conversation individually. But thanks to our panelists, our state health officials, Dr. Levine, Dr. Burrell, and Dr. Smith. We appreciate your time this afternoon. And thanks to the media for sharing these messages as we do get into yet another holiday weekend. We appreciate working with you and look forward to connecting in the future. With that, and because we're a little bit over, I'll just quickly conclude by saying thanks again, and please do follow up with Jane if you have any further questions or clarifications required for anything y'all are working on right now. Take care and stay safe, everybody. It's Mike Fraser from ASTHO wishing you a great afternoon and a safe and healthy